Lie on your back with your legs bent over a chair or an object that allows you to get a 90-degree angle bend at your knees and your hips. Make sure that your ankles are not higher or lower than your knees at any point in this position. The object must allow you to relax your legs completely so you don't have to use any of your own muscles to keep your legs in one position. If you notice that your knees are falling out apart from each other, you can place a strap around them that will allow them to relax into the strap so they don't fall outward. Make sure that the strap doesn't have any kind of elasticity to it so that it presses in against your knees. You're going to place your arms out to your sides at a 45-degree angle from your body with your palms face up. Allow your lower back, hips, and shoulders to settle into the floor on their own. Balance and symmetry check. Pay attention to how your back, your hips, and your shoulders feel as they're lying against the floor. Do you notice that one side of your hips or other parts of your backs or shoulders is touching the ground or heavier into the ground more on one side than on the other? Take notes of any of these differences that are on one side of the body versus the other. They should settle down and become more symmetrical by the end of this position. You also have the ability to lie in this position for anywhere up to 10 to 15 minutes if you notice that you don't settle completely into the position. But it's not necessary to go longer than 10 or 15 minutes. Lie on your back with both legs straight out on the floor in front of you. Bring your arms out to your sides so that the palms are face up and the arms are at a 45-degree angle from the body. Take one leg and bring it up towards your chest, interlacing the fingers under the knee. Make sure the shin stays parallel to the ground at all times and the foot doesn't move up higher or lower. The straight leg should have the foot pointed straight up towards the ceiling and the quad or upper thigh muscle relaxed. With the foot of the bent leg, you're going to make outward circles in a direction away from your body. Make sure that the foot and the ankle are moving, but the shin and the knee are not moving at all. Once you've completed the recommended number of repetitions, you're going to make inward circles the direction of the center of your body. Again, make as full of circles as possible, not moving the shin or the knee. Once you've completed the recommended number of repetitions, you're then going to point your foot away from you and flex it back towards you. Keep your stomach muscles relaxed the entire time. Your shoulders should also be relaxed and against the floor. Once you've finished with the point and flexing, you're then going to switch legs and repeat the entire movement on the other side. Balance and symmetry check. Take notes of the differences between how one ankle and foot moves compared to the other. You'll notice all kinds of asymmetries between the differences of one foot to the other. And of course, as you develop better function, this should become more symmetrical over time. Lie on your back with one knee bent and the other leg straight out in front of you on the floor. Your arms should be out to your sides at a 45-degree angle from your body with your palms face up. Tighten the muscles in the upper thigh, the quads of the straight leg, and flex the foot and the toes back towards you. You want to make sure that the outside edge of that foot is pulled back towards you as well, keeping the quad, the muscle of the upper thigh, as tight as you possibly can and flexed, and pulling the foot back as much as you can. You're going to rotate that straight leg in and out with the movement coming from the hip socket. As you're rolling the leg, you want to make sure that your ankle does not move independently of the leg. For example, when you roll the leg in, you'll notice that your ankle wants to cave in and the outside edge of your foot rolls away from you. You must keep that outside edge of your foot pulled back towards you the entire duration of that rotation. You're going to rotate that leg in and out for the recommended number of repetitions, keeping the upper thigh muscle as tight as possible, and then you're going to switch sides. Make sure that you're keeping the upper body as relaxed as possible. You shouldn't be using any other muscles, such as the glutes, to help with the rotation. Balance and symmetry check. Pay attention to the difference between how the muscles feel as you're going through the rotation from one leg to the other. You might notice that it's easier to flex and hold the quad or the upper thigh tight in one leg than the other leg. You might also notice there's a difference in the ankles and how they feel from one to the other as you're trying to pull them back towards you. Take notes on your findings and recognize that these are asymmetries and they should even out over time. Start on your hands and your knees. Your knees should be directly below your hips and your hands should be directly below your shoulders. You're going to initiate the motion from your hips. Start by tucking your pelvis underneath, allowing your pelvis and your lower back to round. Then, imagine going vertebra by vertebra. You're going to start rounding every part of your back, from the lower back to the mid back to the upper back, and then allow the head to collapse down towards the floor. From here, you're going to start going into extension by tipping your pelvis forward using the muscles of the front of the hips. Now the goal here is to try to keep the rest of the back and the head in flexion as you tip the pelvis forward by itself as much as it can go. When you realize it can't go any further, you're going to start arching the lower back, then the mid back, then the upper back. As you get to the upper back, you're going to allow the shoulder blades to collapse together, keeping your elbows as locked as possible. Once you've gotten to that point, then your head and neck are going to be looking up. You'll now be in full extension. You're going to go back and forth between the movements, initiating the movement from your pelvis and then finishing the movement from the head. Try to prevent yourself from shifting back and forward, meaning keep your pelvis over your knees and keep your shoulders over your hands. Remember to breathe throughout this entire position. Balance and symmetry check. Pay attention to the differences between how one side of the body feels versus the other. Take notes of different things that stand out. Also pay attention to how difficult it is to move the body from one segment to the other. This tells you a lot about the relationship between the pelvis, the hips, and the shoulders. As this gets better over time, this segmentation should get easier. Lie on your back with your knees bent and your feet, hips, and shoulders in line with each other. Make sure your feet are about 4 to 5 inches apart, parallel to each other and pointed straight forward. Take a block or a pillow that is about 4 to 6 inches in diameter and put it between your knees. Make sure that the block or the pillow is firm enough to where if you were to squeeze against it, it would not squish in to where it would be closer than 4 to 6 inches. You're going to apply a very small amount of pressure into the pillow or the block, just enough to hold it to make sure it doesn't fall. Bring your arms out to your sides with your palms face up. They should be at about a 45-degree angle from your body. Throughout the position, make sure that your upper body, your head, neck, and shoulders all stay relaxed throughout the entire position. By pressing both feet into the ground, lift your hips straight up into the air, maintaining pressure of the block the entire time. Once you get to the top, lower yourself back down until your hips hit the floor. Make sure that the movement is done in a smooth, controlled fashion. Try not to get this confused with a typical floor bridge that you'll see in a gym, where the design is to squeeze your glute muscles and tuck your pelvis in order to lift. What you actually are looking for is lifting your hips straight up, enough to where you even get an arch in your lower back. There's no tucking of the pelvis in this movement. You will feel the work in the glute muscles, potentially the hamstrings, a little bit of the back as well. If for any reason you're doing this position and you feel any kind of discomfort happening that doesn't seem to be changing, you can also try doing this movement with a strap around the knees instead of a block. Take the strap, wrap it around the knees to where there's 4 to 5 inches between both knees. You're going to allow your knees to press out lightly against the strap, almost just enough to let them fall out into it, and perform the movement exactly the same. The strap should not have any ability to stretch or give. It needs to be firm so it doesn't move as you press into it. Take notes of whichever one felt better or felt more symmetrical. You'll continue using that throughout the sequence. Balance and symmetry check. Pay attention to the difference between the muscles that are working in one leg versus the other. Do you feel like one hamstring, one glute, or one part of your back works more than the other side? Do you feel a difference in how your feet are pressing against the floor as you do the lift? You might also feel a stretch or some type of activity in the front of your body around the muscles of the upper thighs or the hips. You might feel more working on one side than the other. Pay attention, take notes of the differences that you find, and then note how they change as you continue going through the program and continue doing the movement. Place a block or a pillow between your ankles. To initiate the movement, press and hold your knees out against the strap and your ankles and inside edges of the feet into the block, and hold this for the entire duration of the position. While you're holding the block and the strap, you're going to lift your feet off the floor about 4 to 5 inches, then return them to the floor. Once you return the feet to the floor, you're going to make sure that you are continuing the pressure against the block and the strap. You never let this pressure go. However, when your feet touch the floor, you're going to relax your hip muscles. These are the muscles that you're using to lift the feet in the first place. Once you relax your hip muscles, you'll realize that your pelvis relaxes. Remember that you still have pressure against the block and the strap. As you lift your feet up again, 4 to 5 inches, you'll recognize that your pelvis moves, your hip flexors engage again. As you're lifting the feet and lowering them back to the ground, you'll recognize that your hip flexors engage, your pelvis tips forward just slightly, then your feet will go back down to the ground and your pelvis will return back to normal. Make sure that you have a pause at the bottom when your feet touch the floor so that your pelvis can relax. Balance and symmetry check. Pay attention to the differences that you feel from one side to the other when it comes to how the ankles are pressing into the block, how the knees are pressing out into the strap, as well as the muscles that you're using in order to lift the legs. You might notice that there is a difference between one side and the other. One side might seem stronger than the other. This should change and become more symmetrical as you continue doing this position as well as going through the program. Place a block between your knees. Then place a strap around your ankles and tighten the strap to where you have about 4 to 6 inches of space between your ankles. Make sure that your ankles are not further apart than your knees. Simultaneously, press your knees into the block and glide your feet out against the strap without letting your feet turn out. Hold that throughout the duration of this position. While holding the block with your knees and the strap with your ankles, you're going to lift your feet off the floor about 5 inches, then come back down to the floor. When you get to the floor, make sure you relax the muscles of your hips so that your pelvis relaxes on the floor, but do not allow your knees and your ankle to stop pressing into the strap or the block. Once you've relaxed your hips and your pelvis, you're then going to use those muscles again to lift the feet. Continue this movement up and down for the recommended amount of repetitions. You should feel the work in the inside hip flexors. Balance and symmetry check. Do you notice any differences in the muscles on one side of your hips versus the other? Do you notice any differences in what it feels like to press into the block or out against the strap from one side to the other? Do you feel like there is more strength in one leg versus the other? All of these are asymmetries that are showing up in the body and should even out over time. Place your back against a wall and keep your feet and knees about 6 inches apart. From here, you're going to walk away from the wall until you can allow yourself to slide down and put yourself in a seated position where you are about just over a 90-degree angle at the hips as well as the knees. The goal here is to have your mid-back, lower back, and hips completely flush against the wall. It's almost as though you're going to have a small slouch in your back and your posture in order to make this happen. Your head and shoulders will slightly come off the wall. Keep all of the pressure in your heels, relax your stomach, put your palms face up on your lap, and make sure that you do not use your upper body or shoulders at any point in this position. Keeping the pressure in your heels, you're going to hold this for the recommended amount of time. If you feel like a lot of the work is going into your knees, you can come up slightly until you don't feel the work in your knees anymore. You should feel the work in the upper thigh muscles, the quadriceps. Balance and symmetry check. Do you feel like both legs are working evenly, or do you feel like one leg is pushing into the ground or the wall more than the other? Take note in how even it feels where your back and hips are up against the wall. You might feel like it's not symmetrical from left to right, like certain parts of your back or your hips are touching the wall more than other parts. One thing that you can do if this is happening is to place a yoga block or some type of firm pillow between your knees where you're not necessarily going to squeeze it, but allow your knees to press into it, just enough to hold it, and see if that makes things even out. Over time, it should even out as things become more symmetrical.